It's 8 years down the lane that ABUAD Drug-Free Club has been in the vanguard of the fight against drug abuse through their various advocacies to stem the tide of the effects and to achieve its strategic objectives known as Drug Demand Reduction Strategy.
Meaning that we are not only the ones who now support students, students can now support students in their rooms, in their hostels, in their classrooms. We have social events where students who don't use drugs can come together as a community. That's one of the biggest things that we've done. And then we have attention and advice, which is like a peer support group for students who want to stop or who have a mental health challenge.
By definition, drug abuse or substance abuse is referred to as the use of certain chemicals for the purpose of creating pleasurable effects on the brain. In reality, apart from the long-term damage abuse of drugs causes to the body, its psychological effects, mental confusion, brain damage as well as lung diseases are reasons for the fight against the menace.
That you don't see any negative effects of the drug you are taking now does not mean that that drug has not affected you. You understand? It's only, it's like somebody that is sitting on a keg of dynamite, just waiting for something to trigger it, and you are off.
All crimes today in the country, majority of them are associated with drug intake. And they have been trying, and I will encourage them to gather more students and to do more.
With the growing trend in the challenge of drug abuse, as statistics showed that there are over 190 million drug users around the world, especially among young adults under the age of 30, the ABUAD Drug-Free Club is evolving several measures to orientate and reorientate the public on the need to collectively fight this societal misdemeanor.
What we do is we liaise with other associations in school, we liaise with organizations, and we bring the message to people that drug abuse is bad.
And this drug abuse is something that is very common, especially now. Before, people would hide to smoke and hide to drink, but now it's very open and it's like, something that should be accepted and everybody should do. But we're trying to create an awareness that this isn't something that will be good for you.
Speakers at the program, including a clinical psychologist from Ekiti State University Teaching Hospital, Dr. Ajiboye, official of the NDLEA and students, agreed that Nigeria has demonstrated that the burden of drug abuse is still high, despite the existing drug laws, policies and strategies for prevention, adding that addressing this requires pragmatic and multifaceted approach. With the balance that if drug abuse don't make you pay now, you will pay later, ABUAD Drug-Free Club says it has a mission to establish a two-sided platform where non-drug users feel comfortable and engage in campaigns and advocacy, as well as provide support, counseling and mentoring for drug users who want to stop. In Ekiti, Ayode Jogunshakin, NTA News.